This is Priyanka Srinivasan presenting you Your Messy Minds. In this video, we are going to see about the generalized anxiety disorder. If you see, it's very common for each one of us to face worrying in our day-to-day life, right? So, we keep on worrying for even simple tasks to be conducted in our life. So, in that case, what is this generalized anxiety disorder? So, clinically, when you see, if you are facing this anxiety excessively over a period of at least 6 months, then it's going to be named as generalized anxiety disorder. And during this period, you will be having a lot of muscle tension in your body and a kind of mental agitation where there will be lots of conflicts going around in your mind, and sometimes you will not be feeling sleepy also, and it will be difficult for you to focus on doing something, or sometimes you are feeling very tired in doing some tasks in your life. So now we'll see what are the therapies and treatments for this GAD, that is generalized anxiety disorder. So first of all, if you ask me, there are drug therapies, right? There is some kind of medicines and drugs which are provided for this GAD. But if you really see, it is not going to be that effective, because obviously it will be having its own consequences, like a kind of impairment in the cognition or the motor skills. So if you see the therapies, that is psychological therapies, which is very useful, which is in a shorter period but has a long-term effect in that. So let's discuss each one of the therapies. So first, it is brief therapy. So in this, what actually happens is people who are going through this kind of GAD usually tend to avoid such kind of stimulus which provokes their anxiety, right? So if during this therapy of brief therapy of psychology, they usually present the stimulus which causes anxiety in them. So in that case, what happens is they don't have an option to avoid that stimulus and go away. So in fact, they have to really face the stimulus and go through that stimulus. So they will learn how to go through the stimulus and face the stimulus that is provoking anxiety in them. So the next therapy is the cognitive behavioral therapy, and this cognitive behavioral therapy, which is CBT, is commonly used for most of the disorders and most of the psychological illnesses in people. So in this GAD, CBT is used as a main therapy too. So wherein the people, that is who are suffering from GAD, will learn to face the situations and learn to face the stimulus which is causing their anxiety. Then if you see, there is meditation therapy. So meditation seems to be a kind of relaxation therapy which is very much useful in almost everyday's life situation. So meditation therapy plays an important role. Last but not the least is the mindfulness based therapies. So in this mindfulness based therapies, the patients, the clients will be taught to how to face the stimulus which is causing or provoking this anxiety in them. So these are the various therapies which is there, but all of them in general is going to be on a short term but going to give a long term effect, which is going to be obviously beneficial for us. So there we come to the end of this video with a different psychological content. I'll come and meet you all in the next episode. Until then, it's bye from Priyanka. Bye.